I don't know, where do we begin? So we got the shutdown order, I think in mid-March,
Hmm.
and I have three locations actually. One of them is a health center, but the other two locations are non-medical sites. And so because of that, we decided to have to do like switch turnaround for everybody to telework within 2 days.
When COVID-19 first hit, I still remember that first Sunday when, because Saturday was when they had the first confirmed patient in Orange County. That Sunday morning, we mobilized. We mobilized in regards to, okay, right now we need to call all of our partners that were organizing like the Lunar New Year and cancel.
Now we had to switch. Okay, we can't take you to the doctor, but if you can get to the doctor and you need help translating, call us. And so that's what the case manager has been doing was, the participants would be calling the case manager and the case managers would be on the phone talking to the doctor and helping translate. And to make sure that they understand, whatever the doctor was saying and following up with them and whatnot.
Our first response was just checking in and making sure that people knew they weren't alone, and letting like having materials in language created so that people know that we're still here for them.
So at least for the students that we work in, one of the challenges with really with COVID-19 is for students to transition from in-person to online learning. I think one, it was difficult for a lot of students just because they don't have a lot of like space, like personal space for them to do work.
Really huge increase in mental health. People are feeling really a lot of anxiety, a lot of depression. People have lost businesses. We've had people want to commit suicide because they've just lost their business and had to shut down. As well as people are afraid to go out because of the anti Asian American sentiment. People blaming the community for COVID, and so we're seeing businesses damaged. We're seeing people attacked.
Personally, wasn't attacked. None of my family members were, but we got a couple of phone calls and left messages on our company voicemail to go home, kind of a thing. And I was shocked. I was shocked. So, but I didn't. They just left a voicemail.
But there have been so many reported, hate crimes and hate incidences nationally. Right now for Orange County, we've seen an increase where a lot of people have been attacked or things are said to them, or if they're outside or if they're at the store that's outside a concentrated Asian area, people are blaming them for COVID. Some stores have also had their windows, shattered and, notes taken out. In Huntington Beach, there was an Asian family who got a letter saying, "This is from your neighbors, get out, you caused this all." So a lot of things like that. There's a lot of that going on.
It wasn't a good time to be more Chinese probably than any other race. But to the rest of the world, it didn't matter whether you're Chinese, Korean, Vietnamese, you were Chinese at that point.
We're all lumped into it being Chinese, under that category. And yet they don't understand that we are different ethnically, culturally. And so that's all of this discrimination, racism, these gaps is because like people don't understand and it's easier to lump everybody together.
So, we hear in the news across the country within Orange County, physical attacks, right? People getting hurt, people getting beat up. Most recently, an elderly man who was physically attacked on the bus, right? And then there are people who are being verbally attacked, right? And then there are those who read the news or read chats and they're actually very hurt by what they read. Because for some of them, I can say it's sort of a wake-up call in terms of they didn't realize how much hate there was, and they didn't realize that it would affect them.
Nonprofit community-based work is is always eventful. Of course, right now, living through the biggest pandemic in the century, uh, COVID-19 is really important work for us right now. We are doing um, coronavirus testing. And so I always think about how is COVID-19 affecting the Asian community? Are the resources there for COVID-19 positive patients?
When we look at the numbers here in Los Angeles, although our community is very, very small, we are very, very highly impacted, highly impacted. So I forget what the numbers were the other day. So they can talk about percentages, or they can say that out of 100,000, these many people, you know, are affected. But the most impactful numbers for me are when we say that out of my community of roughly 20,000 people in Southern California, 1 in 177 people test positive.
Also, our workforce development services have really increased because people have lost their jobs. They've lost their businesses, and they're not sure how to access unemployment or EDD services because it's not in language. It's in English or Spanish only. And so we've seen a lot of help that we've had to do that way.
We've had unemployment application assistance, which is one thing we help with, rise over 500%. We have so many more community members coming to us asking for help getting these unemployment benefits because they've been laid off.
Usually unemployed means you're in need of dollars, like the stimulus or the assistance checks, but it also means you're uninsured. And so we've been very busy getting people enrolled in Covered California and the other health plans, so people don't lose their health care coverage.
Another big thing that we've been focusing on is making sure that our vulnerable seniors aren't completely socially isolated. The really cruel, or unfortunate, I should say, thing about social distancing, about sheltering at home or safer at home, is that a lot of our elder community members are in danger of being forgotten, are in danger of like just being alone too long.
And then after that, you know, looking at what happened in Asia, we started purchasing certain items that we knew we did not want our seniors out there to have to be exposed not only to the virus, but also we anticipate the discrimination and the backlash. So we ordered toilet paper, we ordered the oximeters. We ordered so many items because we wanted to make sure our seniors, number one, had the essentials, and number two, understood that there was somebody out there who was caring for them.
For the community members, what I've heard from them is, you know, I think a lot of them are, you know, kind of cooped up in the home. And, you know, before COVID, you know, the agency, the community, the Cambodian Family Community Center, we offer a lot of workshops and exercise classes and, you know, meditation classes and things like that. And, you know, when COVID-19 hit, we had to close our doors, and a lot of community members are now at home. They're like, oh, we miss all those classes. When can we go? And, you know, we're trying to offer them all virtually, you know, and, but it's not the same, right? It's not the same coming into a building and seeing your friends and talking and communicating.
I'm in the restaurant business, so all the restaurants were shut down overnight, and that was, you know, it's gonna take years to recover the shutdown. I mean, you know, it was probably necessary to shut down the United States, but you know, our sales went down like 83%. So it's almost miles and not just close the door because you're not making any money at that point.
It's a apocalypse for the hospitality industry. It's that. If you're a mom and pop like I am, most of the restaurant I know, two of my friends did not open up, you know, because you can't. You just basically you die.
We started a community, a small community of friends, now selling all our stuff at this pop-up. It seemed like it was such a huge service for our community that we're opening up and we're selling stuff, but no, they are doing us a favor. You know, they're the ones that so many people came in and supported us.
One thing that COVID-19 has brought is that to AAPIs is that they realize like they're starting to feel that sense of discrimination against them. And I think COVID-19 has made that more like known and more prevalent. But I think because of that, a lot of AAPI folks are able to kind of share experiences with like Black folks in the Black community and the struggles that they're going to.
But you can tell when you see COVID, you learn, I'm sure you learn about your friends' personality, your family members. They all like, you know, like it's very interesting where I have staff, I thought they're great. Through COVID, I'm like, oh, they're no longer great. And then the people that you think they're not that good, right? And then through COVID, you see their personality shines out and they become very, very helpful. So I think to me, any disaster or anything hits, you can tell who's your soldiers, who's your, you know, your positive, your great folks, and then you can tell people who you think they're great, and then until this happened, and they became selfish and they just do things for themselves. So I think it just overall, you know, you can't like there's no, you know, silver lining, but I see that you learn a lot from people, personalities, and how they live and how they care for each other through COVID.
When someone says to me, someone young like you guys and my children would say like, oh my gosh, Dad, or you have like amazingly, I want your friends, is pretty much what they say, right? Like, I want your friends. And then she revised it really quick. She goes, you know, I want friends like yours. Why? It's because we recognize that friendship and relationship is the biggest thing there is. There is no shortcut in relationship building. They may not be your closest friends, but if they are part of your trusted group, we do things for each other